Hi, my name is Taliba Collins. Today we are going to do a review on how aggression affects social relationships among people with borderline personality disorder or BPD. Dr. Philip Zimbardo once said, "The line between good and evil is permeable and almost anyone can be induced to cross it when pressured by situational forces." 1.3 to 6% of the American population suffers from borderline personality disorder. Situational forces can cause dysregulation of emotions, behavior, and impulsions. Social psychologists have studied several of these situational forces in order to understand why humans react to certain conditions and what factors prompt these behaviors. Aggression in humans can be disguised in several different forms that range from verbal expressions to tantrums, and even committing acts of harm. While we are all aware that aggression lies within all humans naturally, there are certain factors that can influence a high magnitude of aggression, such as a personality disorder, like BPD. Individuals with personality disorders tend to have emotion dysregulation, which can cause high levels of aggressive behaviors. This is seen in individuals with borderline personality disorder. Borderline personality disorder is a mental health disorder which impacts the way an individual feels and perceives themselves and others. This includes situations with self-imaging, emotion and behavior dysregulation, and an unstable relationship pattern. Individuals with BPD have an intense fear of abandonment. This means being alone or being lonely is intolerable. You can imagine how this may look when it involves their social surroundings like friendships, family, and intimate relationships. Individuals with BPD also tend to channel inappropriate anger once they feel there is a threat to their social surroundings. These behaviors can include impulsiveness and frequent mood swings. These kinds of behaviors tend to become a major threat and will affect loving, long, and lasting relationships. Inside the mind of an individual with BPD, they have an intense fear of abandonment. They become extremely aggressive when feeling abandoned. They have difficulty keeping stable relationships, impulsivities, and more. Some symptoms are experienced by those with this disorder, such as dramatic changes in mood, ranging from euphoria to severe depression, an exaggerated self-image, impulsivity, and grandiose ideas and plans. In addition, the symptoms of this disorder tend to worsen during periods of stress and may be temporarily relieved by self-destructive behaviors such as substance abuse. Also, some victims experience sensation-seeking behaviors such as jumping from one relationship to another or jumping from one job to another. Severe anger and depression or suicide attempts when the mood worsens. Aggression. Aggression is a common interpersonal dysfunction of people with BPD. The aggression is often reactive and is activated by social threat, provocation, and frustration. The anger is usually intense and one cannot control it despite attempting to. A study involving 60 women with BPD and a control group without BPD established that the former exhibited more negative emotions than the control group. The emotions observed include nervousness, embarrassment, upset, frustration, and anger, all marked by a titrated mirror tracing task known to induce distress and frustration. BPD affected women exhibited more distress and intense reactions than unaffected women before and after the task. The specific emotion noted was anger, while the rest remained unaffected. Emotion dysregulation. Self-aggression, for example, suicidal behaviors and self-mutilation, aggression, anger, discontrol, and impulsive behaviors are part of the 3 of 9 BPD diagnosis criteria. According to McCosley et al. 2009, measures of impulsivity and aggression can be classified as BPD endophenotypes because the traits vary significantly in general population and are connected with BPD patients. BPD patients report higher impulsivity, aggression, and anger. BPD and social psychology. BPD connects to social psychology because the social model of psychopathology asserts psychological disorders. These are medical conditions resulting from effects of stresses and strains on the human body that result in dysfunctions in social behavior. Renenberg et al. 2012. When a person is held back from attaining the level of rewards others have attained, he or she may become permanently frustrated, which may cause them to regress. However, there are numerous other possibilities for their symptoms. The BPD causes severe emotional instability, which is the inability to maintain consistent emotions. It also causes erratic behaviors that result in emotional, physical, and social damage to the individual suffering from the disorder. In addition, the symptoms of BPD may be exacerbated by numerous factors such as a stressful life, events, difficulties with social relationships, and substance use. Relationships. Borderline personality disorder is strongly linked to distress in close relationships with significant individuals, both romantic and unromantic. Gonzalez et al. 2016 argues that in many cases, the family members lack access to information to understand the condition and its surrounding chaos, support their loved ones, and help them manage the crisis. Interventions are needed to enhance BPD treatment outcomes effectively. Families have been known as fundamental in improving the BPD recovery process due to their role as informal therapists. If left untreated, the daily difficulties they encounter and the emotional burden can result in an upset in the family unit. Dysfunctions in relationships. Will they last? An individual diagnosed with borderline personality disorder has the constant need for affection. Upon not receiving needed attention, can cause a high magnitude of wrongful perception, thus leading to violent reactions that can scale from verbal threats to physical harm of themselves or others. People with BPD affect people around them and society by behaving destructively. They can also present with substance abuse, impulsive behaviors, and suicidal ideation. Other comorbid disorders can occur, such as depression and anxiety, or personality disorders such as histrionic or antisocial personality disorders. In addition, people with symptoms of BPD, such as aggression, affect others close to them through their inability to control their emotions and impulses. Theories. This disorder has been recognized for a long time, but the cause of the condition is still unknown. One theory that explains the cause of this condition is the instability in parent-child attachment relationship. It is believed that people who have BPD are infants or young children who have had some relational problems or detachment from their primary caregiver, whose bond to them was weak and insecure. Additionally, the same theory states that these caregivers often suffer from some mental illness and impairment, which prevents them from parenting their children well. Furthermore, people who suffer from BPD often have a history of childhood abuse, frequent changes of caregivers, or parents with substance abuse problems. Therefore, it is likely that these individuals have some childhood trauma. Another theory regarding the cause of BPD stems from the fact that different personality disorders are often present in childhood and adolescence, and those who have this disorder may have been identified as having other disorders which were possibly misdiagnosed. A more thorough analysis would suggest that people who have BPD are more vulnerable than others to develop a disorder such as depression, anxiety disorder, or other personality disorders. There is a direct link between personality disorders and BPD because they share many symptoms. For example, both frequently show aggression towards others and present suicidal ideations, which may be a sign of psychotic depression. It was found that women are more likely to develop BPD. This can be due to the fact that they have been abused during their childhood or to have had inconsistent parental support. In addition, women with BPD tend to be more socially isolated than men. Furthermore, it was also found that people with BPD have a history of childhood neglect or other adverse events such as physical or sexual abuse. Being involved with an individual that suffers from severe symptoms of borderline personality disorder appears to be quite difficult due to the constant need of attention and maintenance of uncontrolled symptoms, like when a diagnosis having a aggression episode. The ER improvement is beneficial because the unaffected spouse can support the affected one. The other person who should respond when the affected person needs support or caregiving. Depending on how the BPD patients perceive the response as helpful, they should experience better well-being, such as better mood, perceived ability to cope, and reduce anxiety. BPD affected individuals who perceive support will be offered when needed and cope better when faced with stressful adverse life events, hence better health and psychological well-being, and it reduces aggression. The study findings among women with BPD exhibit emotional regulation impairments through failure to regulate emotions in terrifying conversations with their spouses. During these frightening conversations, the women in the study displayed negative support-seeking tendencies, potentially eliminating the probability of support from their husbands. The findings help establish the reason for romantic relationship dysfunctions in BPD patients, promoting the use of dyadic ER strategies in its treatment. Solutions and treatments. What should we do next? Normally, antipsychotics are regularly given prescriptions to control psychotic outbreaks in personality disorders, which include emotion and impulsations. Therapeutic treatments for both the diagnosed and their support system is also a necessity for treatment. Solutions and treatment. It was established that the most empirically supported intervention for families of BPD patients is family connections, or FC. This is a group format dialectical behavior therapy adaptation delivered in 12 sessions. Successive versions of the model have proven its effectiveness for BPD among family members. Thus, FC has helped reduce the burden as well as improving mastery, empowerment, and hope. Conclusion. Taking everything into account, emotion dysregulations are highly seen in individuals with untreated therapies for BPD. In addition, it has been proven that aggression amongst all diagnosed persons are barriers to their social surroundings and selves. Research has established that support from family members and spouses significantly contributes to the treatment therapy of BPD patients. One of the main strategies geared towards family support is family connections therapy, which has been proven to alleviate the burden and improve mastery, empowerment, and hope. Romantic partners have been known to contribute more towards a perception of rejection to the affective than the rest. Interventions directed towards psychoeducation to inform them of their roles in recovery.